did you win? Injection. Injection. You won an injection on your buttocks. You won an injection. I will be the one to give the injection.
And then I can't find a for me. At least he's a native doctor.
Do you know how I'll give the injection?
How?
I'll throw the syringe like a dart. I just say, hang your buttocks up.
The guy who's been doing the dart thing in the UK right now.
Yes. I'll throw it like a dart. I'll gauge the buttocks, the middle.
Lovely afternoon. It's good to be here in the studio once again.
Yes.
Yep.
Thanks a lot for coming by. How's the week been? Have you had a good week?
Oh, it has been fantastic. It's been reflective as well.
Reflective?
Yes, 10 years.
Okay, right, of course.
Medicus.
Yeah.
So we're in that mode where we're just taking stock of all that has happened in the last 10 years.
Yeah.
So many people that we want to say thank you to, and also so many important milestones we attained during the period. Kwame, you know what? Although we are healthcare professionals, and somebody will think, oh, okay, what's the big deal about a doctor and an anesthetist running a hospital? But Kwame, it's a healthcare business. And in medical school and in nursing school, they will teach you paracetamol and injection, not the dart type. But nobody teaches you the business.
The business aspect of it.
The 10 CDs minus 8 CDs give you 2 CDs and that kind of thing.
And even the people management as well.
Kwame, I know dear. You can ask Moses.
Because that's a very big part of it.
Exactly. It's a huge aspect of it.
Yeah.
So it's been a steep learning curve for me, for Nana, Kwesi, that at the top.
Yeah.
To manage people and to lead as well.
So I was so impressed when you actually told me that you're actually going to school for an MBA.
Yes, because Kwame, it got to a point, it didn't take long for me to realize how inadequate I was, at managing the business.
Okay.
That there's the money part. There's how do you get the syringes in? How do you get medicines in? You're not taught that in medical school. You're taught how to make a diagnosis and to treat people. But I want to do surgery. Why are the lights off? Why don't we have oxygen? Now you have to learn how to. So it's very, very important that I get that kind of grounding. Yeah. And it wasn't easy. It was 2 years. University of Ghana Business School, prestigious University of Ghana Business School. But I put it off, and I was like, no, I got to do it. And Kwame, adult education, it's not easy. When you're learning that your kids, boys, they're not kids anymore, they say I should call them teenagers.
Okay.
So, Kwesi and Kofi, apologies. Teenagers. The teenagers are also steady.
Yeah.
And then Kofi will come and tell you, that I make sure you don't disgrace us.
I like that. You need to go show them your reports. Actually, you need to go and show them.
They're always demanding it. Hope somewhere. Oh, Papa, that will tell you how to remember pressure. So it's been all of that.
I think you've had a very inspiring journey, and I need to say kudos to you. I think at some point we need to have you on Personality Profile to chronicle the journey, because you've done pretty well, honestly.
Thank you.
From being a medical doctor to managing the business, and it's refreshing to see you, thinking through all these things, procurement, HR, publicity, all of that. I mean, you've handled it, and Medicus is probably one of the biggest brands when it comes to medical facilities here in Ghana now.
Right. And thanks to the entire team here at Multimedia. I mean, we couldn't have told our story without, this platform, and also the opportunity to talk about healthcare, which is something I'm very, very passionate about. This is a wonderful platform. And although, do you remember our first day Of course, this studio didn't look the way it looked.
it was quite
It was a very, very small,
Yeah.
almost claustrophobic kind of studio. And I do remember you coming into the corridor and say, "Okay, do you have butterflies? Are you nervous?" And I was like, "Yes." It was like, "Okay, fine. Then you'll be fine."
That's something I want to say.
It's like, "Oh yeah, because everybody's nervous, so don't worry about it. You'll be fine." And it's been 8 years, and that journey in that platform for us to talk about healthcare. And we all know how very important it is. Being out of your comfort zone, the consulting room, the theater, the labor ward, the lab is my comfort zone. But I think I can confidently say that now this studio is another comfort zone that I have.
One of the most inspiring moments for me, and I'll not tell that story now, but I'll just tell you where it was the conversation we had at Ebenezer Presby Church.
Okay.
Yeah. And I'll tell you what it did, or what I actually thought about someday.
2017. Wow.
Yes.
That's a long time ago.
Anyway, so we're glad to be back. Last week we looked at some of the common lab tests and what they actually meant.
Yes, the utility of those tests.
Yeah.
I couldn't get through that, but we also wanted to give listeners the opportunity to also, call in and ask a few questions about some labs and what, not the interpretation of your results per se, but what the lab seeks to do.
Yes.
And Kwame, let's end off with the third test that we couldn't talk about, which is the OGTT, the oral glucose tolerance test.
Okay.
Most pregnant women some pregnant women, or a significant number, would have done this test before. During the pregnancy, you may pay a visit to the antenatal clinic, and your midwife or the obstetrician gynecologist would recommend that you take a test because your belly is bigger than the expected age of the pregnancy. And sometimes all we need is a simple tape measure to come to that determination. The doctor may do a scan or ask a sonographer to do a scan, and if we find out that the baby or you're carrying is bigger than the age, because the fetus will grow week by week, will add to the weight, so we expect it to weigh or have a certain weight by a certain week. If you go beyond that, then your doctor will have a suspicion that, hold on, you probably as a mother have too much glucose in your blood.
Okay.
And therefore you're sort of like overfeeding this, baby growing inside of you. And that's why it keeps growing bigger and bigger. And therefore would ask for a test to determine whether or not you have developed what we call diabetes in pregnancy or gestational diabetes.
Okay.
All right. So what will happen is that you would come in on an empty stomach in the morning, and then a blood sample will be taken, the glucose will be measured, and then we would prepare a glucose solution for you to drink very, very slowly over about 5 minutes. You sip it for about 5 minutes. Then afterwards, you will be called after about an hour and have a blood sample taken, and then we will do another at 2 hours and then a third at 3 hours for that determination of whether or not you've developed pregnancy-induced diabetes.
Okay.
The other bit is that the OGTT is also the gold standard test when we want to really clinch a diagnosis of diabetes mellitus, the type 2 diabetes. We want to clinch that diagnosis. The gold standard test. There are other tests. There's a fasting glucose that you can do, which has been validated. There's the A1C, which can also be used, but the OGTT test is the gold standard test to really prove that you have diabetes. But because we are giving you glucose, a glucose drink, it is more like a provocative test to provoke the true picture of how you handle glucose to show up.
Yeah.
Because sometimes when people are fasting, just like when your father and mother are around, we're all good boys and girls, right? But I could do Katanga and
Fellows, charge!
and then they have the Vandals, me and my people. They will meet for the Kuva games, and then there's lowering of standards, and there's singing of
Yeah.
The
Gospel songs. Singing of the gospel songs.
Yes. What am I saying? Choir near CVC,
What does it stand for?
Charismatic Vandals Choir. They say President Kra say we me too.
Oh, sir.
And I am say bibi sir.
Oh, I see.
Eti yenim no suba when we close our eyes behind the scenes we can imagine him. Anyway, so this test would provoke and would really show how a human being handles glucose, when they are provoked. So it's a very, very important, test that is done. So if ever a doctor suggests to a pregnant woman to do an OGTT, or there's a suspicion because your urine tastes sweet and your doctor requests for you to do the OGTT test, then you know that he wants to be 200% sure you are diabetic or you're not diabetic, or you have developed something we call pre-diabetes.
Wow. Yeah. Okay. Well, this is some good information. We are going to activate the phone lines now, okay? If you have any questions about any of the tests that we talked about last week and this week. Last week we talked about the urinalysis.
We talked about the urinalysis, and
Yes.
then we also talked about the full blood count, my
blood
favorite
count,
test, which looked at the different bloodlines that are in there. But people can also ask questions about the Blue September.
Oh, right,
All
yeah.
right. The prostate cancer or prostate disease awareness, month, which is the month of September. And we've put out this promotion, just to encouragement. And I have been thrilled, absolutely thrilled by the response. Mr. Ashiboy, I know you're listening right now. You paid us a visit, and I know you are an ardent listener of the show. So many men have come in since we started the Blue September promo to get their prostate checked. So please come in tomorrow. There'll be lots of people coming in to take scans. So please come in. Your prostate health is absolutely important.
Okay.
Right.
Well, there you go. The number to call is 0302-216-541, or you can send us a WhatsApp message if you're unable to call on 055-1111-997. If you need clarity on anything at all, you can reach out to us. Hello.
Hello.
Hi. Welcome.
Welcome. Hello. That is good morning. Sorry. Good evening.
Yes, I understand. It's okay. It's okay. You're welcome. What's your name?
My name is Augustus.
Augustus. Okay, Augustus, you're live on air. Let's hear you.
I'm a diabetic.
Right.
Then I think I've had it for 21 years. And then I also metformin. But later on I switched on to government. Because the government is a bit expensive than the metformin. But recently when I went for a checkup somewhere about 3 years ago, it's like my kidney is not functioning the way it should be functioning. So I was a bit scared. But I wanted to come over the doctor. Frankly speaking, honestly, I'm not that sound. So I wanted to call doctor, to at least to give me, if we to do another test, and then to give me maybe an idea of, if I should come over. As I was speaking from the central reading, straight through, if I come over, how much it will cost me for the lab test, and then if the end has bad for me, it gave me. It really affects my head. It's not making me to sleep at all. No, actually, for the past 15 years now, I've not been able to sleep for 4 hours. I'll sleep just 2 hours the whole day. And then when it happened that with my blood pressure, normally goes up. But when I travel, I sleep for just 3 hours or so continuously without waking up. My blood pressure is normal, at least 120, 80, sometimes 130, 80, 120, 78. But the moment if I don't sleep, yesterday the whole day, I couldn't sleep at all. And then when the family this way too, even though I don't experience any headache. I don't experience it, but I spread benefit sensation, and then I sweat a lot
Okay.
where I don't sleep. So, I'm more than happy, if just again, just justice to.
Okay. All right. I'm sure doctor can respond to that.
Right. So I think the best thing would be to reach out after the show, because he's given out some details and I would need a bit more clarity on that. So we can definitely, I think he's coming from Swedru or
Yes.
calling from Swedru or so. So we'll definitely have a conversation after the show. So please wait, pick up the number after the show, and then we'll reach out to you as well. And then we'll have a
So
conversation.
with regards to his issue,
The kidney. Kwame, I think the truth of the matter is that sometimes the interpretation of the lab result, if you don't do it properly, you end up creating the fear and panic amongst patients. Nobody would have 100% kidney function from age 40. We know kidney function begins to decline. All right. So we need to put that decline in perspective. My dad is approaching 80 years. So if he comes to the hospital and he has a certain kidney function, I don't expect his kidney function to be like your kidney function. So the perspective is that he's 80 years, he has a certain kidney function. If you just read it off the face of the result, you think, oh, hey, what's going to happen? Well, nothing's going to happen. That's what happens when you are 80 years. So the context is very, very important. So
Okay.
I would urge him to relax, but it is an important test that we do for people with high blood pressure and with diabetes. You need to check their kidney function. So
Yeah.
it's very important. We'll have a conversation before he comes all the way.
and he also mentioned that his financial status as well.
Exactly.
Do doctors consider these kinds of variables in planning out a treatment modality?
Oh, absolutely. I mean, it is one of the central, themes in developing a care plan, for a patient. You need to consider. And thankfully, I think that's one of the things that we do very well in Ghana, because that is whipped into your training. I've worked in the rural, areas of Ghana before, and there, Kwame, I mean, you may think 20 CDs is nothing, but it's a lot of money. So you really think through the patient's problems and their socioeconomic status before you make decisions.
Okay.
You talked about Galvus Med. Yes, it is a pretty expensive medication, but I'll tell you, insulin is far cheaper than Galvus Med. But insulin is the most efficient drug that we have for managing diabetes. But most people will balk at the idea because it's an injectable, and in their minds, it is an injectable like the way the dart-like injection that you wanted to give me.
Yeah.
But it is nothing of the sort. My father injects insulin. He's been doing that for well over 10 years. It is not a painful injection. So these are all different variables that we can talk about. So let's have a conversation at the end of the show.
All right. You can also reach out 0302216541 or WhatsApp us on 055-1111-997. Got a message here. Why is someone asked to do a PSA test even after a surgery on prostate has been done and the prostate has already been removed?
Most likely, the why the prostate was removed is the answer. So, Kwame, sometimes we will have a radical prostatectomy done simply because the person has prostate cancer. Cancer can spread, and the PSA comes from the cancer cells. But when you are doing the surgery, it is not possible to see a cell during the surgery. You see cells under a microscope. So you may think that you've removed the entire prostate and the surrounding structures. However, that may not be the case, and you'd have some of the prostate cells already migrating to other parts of the body. Wherever they are, they will still produce the PSA. So if the reason why he had the prostatectomy done is because he has prostate cancer, then it is a very important follow-up tool.
Okay.
Very, very important.
Okay.
All right.
All right, that's good. 0302-216-541. Let's get back on the phone line now. Then we've got a friend here. Hello.
Yeah, thank you.
Yes, sir. Welcome.
Hello, dear sir.
Yes, boss.
Hi.
Yeah, I want to ask a question.
Go ahead.
Doc, good evening.
Good evening. How are you?
Prostrate. My dad had a prostate surgery at age 90. No, I think 86.
somewhere in his 90s. Okay. Before passing.
Okay.
Okay. My dad passed at 92. I am 40. Do you recommend that I should go for prostate checks?
Why did he have the prostate surgery? Was it a benign enlargement or he had a cancerous prostate?
No, it wasn't cancerous. I guess it was enlargement. I'm not medically inclined.
Okay, all right. So if it is benign,
it wasn't cancer.
It wasn't cancerous. If it wasn't cancerous, then the recommendation would be 40. 45 is a nice number for you to start your checks if you don't have any symptoms. But if it was prostate cancer that caused the enlargement and the subsequent removal of the prostate, then it would be a good idea for you to start at an earlier age, and 40 would be a very good number. But if it was a benign prostate enlargement, then you should start educating yourself about prostate symptoms, all right? And then from 45 onwards, it will be a good idea to start doing your PSA, doing your digital rectal examination, and then doing your prostate scans.
I hear.
All right. Thank you so much for calling in. This has been very, very educative, and I like that, Doc. Thank you so much. You're far too kind. I got a message here. Good afternoon, doctor. Please, there was this injection given to me 10 years ago whilst I was pregnant, and I was referred there due to pre-eclampsia.
Okay.
Which I will never forget. You will feel it in your whole body.
Ooh.
What's the name of that injection, please?
Hey, this one is the riddle. This thing of the National Science and Maths quiz, the riddle bit. All right, I am not sure what that injection would have been.
Yeah.
I mean, it could be a number of different things. There isn't enough information to know that preeclampsia is some hypertension related condition that can progress to the woman having fits eclampsia and she can lose her life.
Okay.
And we give them, when we're going to have something we call imminent eclampsia, we can give them certain medications. Some of them is given intramuscularly and it can be very painful.
Okay.
Magnesium sulfate.
Okay.
It can be given into your muscle and it can be very painful. But it could also be diclofenac. It could be a number of different things, but
Okay.
probably that was what it was.
Anthony says, I'm just passing through to greet two of my favorite doctors. Well, yeah. Yeah.
That would be Dr. Osafo and
Dr. Lexus Bill. Why are you laughing?
Are you for the Are you for
G-Tech.
G-Tech for
He says I trust you're doing good. It's my prayer we all heal from our sickness. Oh, Hannah, damn it. Yes, it's my prayer that we all heal from the sicknesses we're suffering from. I did
Amen.
a full blood count 2 months ago.
Amen.
The doctor gave me a high five. I look good. Anthony, thank you. That's
Anthony,
great.
we all look good. Yeah.
We thank God. Doc, this Saturday we're walking up the mountain. Please tell
Yay!
people why they should come for walk with Lexus on Saturday.
Please walk. It is good for your heart.
Mm-hmm.
Your heart pumps and it sends blood all around your body. So come join us. Let's walk with Lexus. I
Yeah.
will be there.
Hannah is coming along as well. That's great. Yes. Are you coming?
I am coming.
Oh, that's good. That's good. So Saturday morning, we're meeting at the Imensa police station at 6 o'clock, like we always do. We'll walk up to the Pediase Lodge Tavern this time. We're doing the aerobics at the Lodge Tavern. Yes, and then, of course, a lot of fun Saturday morning. So if you're listening in, make sure you join us. Doc, please give us your number before we switch over to the news. Hold on, Doc. Yes. Go ahead.
501 477 340. Same number on WhatsApp, 0501 477 340.
Dr. Hannah Odame is here with the latest updates.